I've come to the conclusion the current global development model that we're using is no longer fit for purpose. I think there are new challenges in the field, and there is an appetite for doing things differently. Prior to starting the Baobab Institute, I worked for about 15 years as CEO of IntraHealth International, a North Carolina-based international NGO that focused on family planning, reproductive health, but also human resources for health. Right now, I'm based in Dakar, Senegal. We set up the Baobab Institute for the very specific purpose of contributing to the whole movement toward localization. I felt that one of the requirements for succeeding in localization was the assurance that there are strong institutions and individuals in the field, and especially for Francophone West Africa, where there is a dearth of institutions and where the region has not really gotten much attention in terms of resource allocation. In the first couple of years that we've been looking at the landscape better and trying to decide how can we add value. We pay a lot of attention to money and financing. The first major activity we have is actually a re-granting program where we are working with the Bill and Melinda Gates Foundation to set up a new fund that is easily accessible to mostly frontline workers. Our second focus is digitalization. Digital health is probably our best enabler to reach universal health care. The third one is training and learning, including leadership training, including retraining of health workers. What is the latest in terms of human-centered design, things like that. We have set up the Baobab Institute to be regional in nature. That's through our board, through the focus countries that we have. If I take this region of the world, West Africa, for example, countries are relatively small. So what can you do as an individual countries versus what can you do in regional? And we have not been talking and thinking a lot about that. And I think we do need to do that, even though it's going to be challenging because the nature of the work right now is so bilateral. I worked for almost all of my career for an international organization, and by the time I retired, all of the major functions, the executive team, are still based at headquarters. There's no reason we should continue to work that way. I think we should be courageous enough to say we could move some of these key positions to the field. There is some work to be done from local actors for localization to happen. One is, I think there needs to be a change in mindset. I think people have to believe in it, and they truly have to believe that we can do it. There are a lot of people like me who might be from the region, but who was trained in the United States and molded a certain way. I do think it does take that courage to make sure we're not part of the problem we're trying to solve. This is not going to happen overnight. It's actually a long-term commitment. We are talking about changing a whole model, changing a whole system, and I think we're going to see the results little bit by little bit.